people who woke up mid-surgery, what happened? Before we start with the first story, please hit subscribe and ring the notification bell to stay updated with us. Story 1. I was awake for both of my hand surgeries in 2023. One time, I was watching them quietly and the surgeon and assistants were talking about getting lunch after and they wanted tacos. I said, "Have you ever tried local taco place?" And the assistant said, "I forgot you were awake." I guess they don't operate on a lot of local anesthetic patients. We all got a good laugh. Story 2. I was having cataract surgery late 20s, thanks mom and dad for the cool genes. Beforehand, I let them know that I need a bit more pain meds than most people. They were like, "Oh, you'll be fine." I see this crazy bright red growth and it's completely silent. Somehow I was able to get out, "Guys, I'm awake." At least in my brain. That's what I said, and it was silent. I was trying so hard not to move my eye because, scalpel near your eyeball melting your lens is terrifying. I started shaking my hand to get their attention, and they finally said, "We've got a mover." And praise God, something about more drugs. Everything went well, but I get in a panic thinking about that often. Story 3. I have woken up for 1 tooth extraction and 2 colonoscopies. Spoke to the anesthesiologist on all occasions when I was supposedly under. They topped up the dosage, and I fell asleep again. For context, I am a stealth redhead. The hair in my head is dark, but when I was younger, my beard was red. I also have a redheaded kid, so I clearly carry the gene. The redheads are notoriously tough to anesthetize. Story 4. Was having a rhinoplasty done to fix my janky crooked nose. Woke up to the sound of classical music and a blood-soaked rag over my mouth. Unable to breathe due to all the blood pooling in my throat and nose. I couldn't move a muscle, but my body kept involuntarily coughing. The doctor evidently put the rag over my mouth to keep my coughs from spraying him with blood, but the rag became so saturated that it didn't allow for any airflow, which effectively felt like being waterboarded. Sometimes when I coughed, the bloody rag would move off my mouth, which gave me the opportunity to gasp for that sweet, sweet air until the doctor put that rag back over my mouth. Every now and then I felt the pressure of the doctor pushing a rasp into my nose and shaving away at the bone. No pain, fortunately. The sensation of suffocating and not being able to do anything about it was terrifying. Story 5. I'm an anesthesiologist. The chances of experiencing awareness under general anesthesia are extraordinarily low. There are 2 patient groups that are at a higher risk for this: cardiac surgery patients on cardiopulmonary bypass and trauma patients. Even then, the occurrence of this is very low. Most of the time when people describe being aware, they were receiving monitored sedation, where they were breathing on their own and not general anesthesia. Some people also remember waking up in the operating room at the end of surgery and mistakenly think that the surgeon is still operating when they're in fact putting the dressing on. I think you should discuss this worry with your anesthesiologist. They should be able to provide some reassurance. The vast majority of the time, those who get general anesthesia also receive a benzodiazepine medication that specifically causes amnesia. We do this on purpose to prevent exactly the thing you're worried about. Then, apparently, according to the weather forecast I heard on the radio this morning, a powerful cold front is approaching our land. In reality, anesthesia is the safest medical specialty because of all of the tech and safety equipment that we use. Getting general anesthesia is less dangerous than riding in a car or crossing the street. Hope this helps, and I wish you a speedy recovery. Story 6. My story is from the other perspective. I was still an intern at the surgery department. Had to work there for weeks or so, mostly just observing and sometimes performing simple medical procedures. The patient had paid a lot of money for a new pair of boob implants. I assisted at the surgery, again, mostly observing. The surgeon was done with placing the implants, wrapped up and walked away, telling me to stitch her up. I knew how to suture wounds, but I was still a rookie and very slow. I wanted to make sure I didn't make a mess because aesthetics were obviously very important to this patient. I was halfway the second wound when the patient started waking up. The nurses got angry with me for not working fast enough. It was awful. I knew instantly that I never wanted to become a surgeon. Story 7. I woke up during an endoscopy. I had the tube and everything down my throat, but I didn't know what was happening, and the only thing I could focus on was how I couldn't breathe. I clearly remember trying to talk to tell the doctors I couldn't breathe because I could hear people around me, but apparently I didn't actually say anything. The doctors noticed because my heart rate started going crazy, and then I stopped breathing altogether. They took out the tube, I started breathing again, and gave me more anesthesia. Once I was in recovery, I was told to always inform the anesthesiologist that I woke up during a procedure so they can adjust accordingly. I've had 2 other procedures since then and have not woken up during them. Story 8. It has happened to me twice, once during an appendectomy and once during a complicated cataract removal under anesthesia. All I remember from the appendectomy was trying unsuccessfully to move. The cataract surgery was worse. I was very acutely aware of the tools in my eye and the sensation of something in my eye being pulled on. And I remember making a very strange, fearful moan until they re-anesthetized me. I remember the anesthesiologist patting my forehead as I drifted back out. Story 9. I woke up for a moment during my wisdom teeth extraction and could feel the pressure of the teeth being removed. I looked up and saw a bunch of people in the room. Can't remember what they were talking about, but something had happened to the IV in my arm and they stuck the needle in my hand. They gave me more anesthesia and ended up having trouble waking me from the anesthesia. Apparently, they couldn't wake me for hours afterwards and got worried and called my parents. Finally woke up, and the first thing I heard was my dad walking in the room, and I was totally out of it. Story 10. My surgical team purposefully woke me up during jaw surgery. They put me under, and the next thing I know, I'm being told to open my eyes. I eventually managed to open them, at which point they cover my eyes with a towel and continue with the surgery. I couldn't feel pain, but I could feel the pressure and hear the cracking of bone reverberating through my skull. I also clearly remember feeling warm liquid running down my face and wondering if it was blood. I silently cried the entire time. Eventually, they finish up and take me to recovery. One of the nurses comes in and says, "Tisk, and I thought you were a nice girl." Unable to talk, I look at her with confusion and grunt. "You don't remember?" she asked. She gets all excited and pulls in another nurse to tell me the story. Apparently, when they started the surgery, my subconscious took offense. I broke the restraining equipment, ripped out IVs, injured a nurse, tried my best to decapitate the doctor with the broken equipment, and was screaming at the top of my lungs for them to let me go. I remember none of this. As far as I am concerned, I was asleep. Story 11. I never woke up mid-surgery, but I had a special case of a half-state coma, where I was sedated but still half awake. This was because for the surgery, I had to move my body when the surgeon told me to. With a full coma with narcotics, this is not possible. So I had this state between being normal amp, sober, and being high because of the propofol. It was a very strange experience. What I remember is that I drifted off with my mind, like for some time I thought I'd be on a beach, like in Holiday in Summer. Then I suddenly heard the surgeon again that gave me commands, and I had to concentrate to be barely able to move my eyes in the way he wanted. It was an eye surgery. I had to look left, right, up, down, and so on while I was sedated. They actually used cocaine drops, and yes, cocaine, not lidocaine, like in most other cases for the eyes. But I had no drug effect of this. It's very rare that cocaine is still used in medicine, but it's still available. Anyway, I had to go through this surgery about strabismus and it went well. But again, I was always in some dreams until I got awake again when they spoke to me. Whenever they stopped to speak to me, I again drifted off to the world of dreams. Guess, this is not what Op wants to hear, but it's very rare that someone wakes up and stays awake during a surgery. When you just get awake for a moment, that would not be bad. You are sedated and numb because of the painkillers, oxygen mask, etc. Story 12. Woke up during a cardiac ablation. They literally burn spots in your heart to prevent atrial flutter, and that's what it felt like, someone burning the inside of my heart with a lit cigarette. Edit that perhaps should be lighted rather than lit. I always mess that up because it just sounds wrong to my ears. I got about burns, and I was awake for of them. I was wearing a CPAP, so I couldn't really talk, and they told me to stop grunting and squirming in pain, which made me wonder why they weren't at least curious why I was squirming in pain. There was enough residual anesthesia where I couldn't anticipate future pain, so it was like the same burn being repeated on a loop, like a fever dream. It hurt like a bastard, but it didn't worry me, if that makes sense. I told the surgeon the next day and he just said, I always felt I should have gotten a 10% discount on the anesthesia, or a free brownie from the cafeteria or something. Side note, they wanted me to remove my wedding ring before the surgery and I refused. But I couldn't say why with my wife right there. If I was going to die on the table, I wanted to be wearing that ring when it happened. Story 13. I woke up midway through my ACL surgery. I remember coming to and seeing the ceiling and a nurse or two. It was very blurry. more so than things usually are when I'm not wearing my glasses. I heard something that sounded like a weird buzzing noise, and then some frantic voices, and I tried to shift, and that's about it. I woke up something like 4 hours later. When I came to, my boxers were stained in blood, and I was both concerned and the most tired I've ever been. I kept trying to fall back asleep, but they told my girlfriend and parents to make sure I stayed awake, at least until I got home. I remember struggling to get into my dad's minivan and then crying most of the way back because they wouldn't let me sleep. Apparently, I woke up and started thrashing and ripped out my IV line, so I ended up needing blood transfusions. Luckily, I had done an autologous donation for I have type AB blood. I donate as often as I can to get karma out there just in case I up and need a transfusion in the future since it's so rare. I'm not sure how many I ended up having, but I remember for the first week, I couldn't sit up in bed by myself, and when I'd go to sleep, I would dream about the blurry surgery suite and muffled voices. I was at the time, so my parents were taking care of me, and my mom was so worried I would get addicted to painkillers she never filled the Vicodin prescription the surgeon gave me. I did the entire recovery with children's Tylenol, so the first 2 weeks or so I pretty much just cried while trying to watch movies, and when I slept I just kept remembering the surgery suite. After a month I started my physical therapy, but my insurance only covered visits total, so it didn't do much. My insurance didn't cover much of the surgery either. I remember my parents having to take out a loan since our cost was something like $26,000 after insurance. That was years ago now. My knee is worse off than before I had the surgery, and I still have dreams about the surgery, mostly just whatever that buzzing sound was nowadays and the blurry ceiling. But I'm having them less often now. I actually have a torn MCL in my other knee, and it's going to stay like that because I refused to get the surgery for it. Story 14. They had given me a paralytic along with the anesthesia, not enough anesthesia. So when I woke up too early still in the operating room, as they confirmed the procedure was done correctly, I couldn't communicate that I was awake and the breathing equipment wasn't properly on or something. I thought I was going to suffocate to death. I kept trying to scream for help, but nothing would come out. I could hear the nurses talking about their weekend plans. Finally, my pulse ox monitor or something started beeping. It took them an eternity to realize it and adjust my breathing tubes. No idea how long it was, but I remember vividly how afraid it was and what I was seeing and how badly I wanted the suffocation to be over. When the paralytic woke up, I had a panic attack that lasted a few hours, and they acted like they were so annoyed with me and gave me an IV of Xanax and got me out of there as fast as I could. I was a mess for about a month after I thought everything I was experiencing was deja vu. I'm an avid runner and couldn't run without feeling like I was above my body. I guess classic trauma response. After a month, I reset back to normal, and telling that story definitely helps too. And the silver lining is that I realized I really like being alive. Story 15. I came to in the middle of an operation that cut out 3 sections out of my small intestines. This literally happened to me 2 weeks ago. I was fully anesthetized, so I couldn't open my eyes or anything. I was intubated, so I wasn't breathing either, but my blood was fully oxygenated, so my brain turned on basically. I couldn't move. I couldn't feel myself breathing, but I could hear murmurs of people. I was filled with panic. It was terrifying. I don't know how long it lasted. Next thing I remember was feeling sleepy, and all I wanted to do was sleep, but somebody kept pinching my right arm telling me to wake up. It got so annoying that I decided to wake up. Then it happened again. All I wanted to do was sleep, but somebody kept telling me to breathe. When I finally came to, my hands were in mittens tied to the side of the bed. I don't remember this at all, but apparently when I came out of it, I started ripping all the hoses and tubes out of me, so I had to be sedated again, so I lost a day. Oh, and the hospital lost all my property, so that's a nice bonus. My wallet, my cards, DL, SS card, green card, all gone. House keys, car keys. So I have to rebuild my entire life when I get out of here. I'm in a nursing home now because I still have to get IV fluid and I still have a PICC line. I no longer poop as my large intestines aren't connected to anything, and I poop into a bag now, which is gross. Not the waste itself. That's just chewed up food and digestive juices, but the bag fails and leaks at times. I have to invest in mustard yellow clothes. Double gross. I have a gnarly 10-inch scar going from my stomach to my pubes. When all this heals in 3 months, they're gonna open me up again to reattach everything. So the rest of the year is pretty much shot. Alright folks, that's a wrap. If you like more of this, please hit the thumbs up and subscribe to the channel. You can also share your thoughts in the comment below. I'll see you in the next video.